Okay guys, so first of all thanks for attending this demo. So basically this demo is for the in-depth surgery coding. So usually I will provide only live chat trainings. So but nowadays people are asking in-depth, they want to learn in-depth surgery training. Okay. So because of this coders interest, I am going to start this new session. So this is the demo session basically, and always my intention is to share knowledge and gain knowledge. So if I share my knowledge, I will gain knowledge because of your questions and some other things. Okay. So and about me, so basically my name is Harish Gupta. So I am the creator of Passcoder 21 YouTube channel, and currently I am working as a ambulatory surgery auditor for one of the MNC in Hyderabad. Okay. So nearly I have 10 plus years experience in medical coding all specialties including IP and OP. And also will provide trainings in people from UAE, India and USA. Okay. So these are the YouTube channel. Most of the time you guys know Passcoder 21 which is for English people and Supercoder 21 which is for Telugu people. Who wants to learn Telugu, you can watch this Supercoder 21. This is the brand new YouTube channel basically. Most of the valuable information you will found in the Passcoder 21. Okay, so this is about me. Next, whenever you want to learn surgery coding, we need to have basics or fundamentals. Okay, in our live in-depth surgery training, first we will learn about fundamentals related to CPT, which includes guidelines and layout. Okay, and also we will learn surgical package concept, which is the most important concept in the CPT surgery coding. If you know this concept, you can code any chart in easy steps. Okay, this concept includes global periods included versus separately reportable services. Okay, so just I will tell you how to code the complex procedures as well as the separately reportable services. And in CPT without modifiers, you can't code any chart. Okay, so because of that reason, in the fundamentals, we are going to learn modifiers also. Okay, so in modifiers, you are going to learn all these 50, 51, 58, 59, 78, 79, along with example scenarios. Not only definitions, you are going to learn example scenarios also related to these modifiers. In this training, we will use mostly codify as well as 3M. Okay, and also client integrity based on necessity. Okay, so practically I will show you how to use these modifiers in the live coding. If you encounter any type of edits, how to resolve those edits using these softwares. Okay, next, specialty based coding. In our live in-depth surgery coding, these are the most important topics you need to master. Okay, for example, if you take general surgery, hernia repairs are the most common procedures you will encounter. So without hernia repair coding, you can't do same day surgery coding. Why means these are the most important and common procedure you will encounter. For hernia repairs, we are having few basics or key terms. So those things I will explain during our live session. And also one of the most important concept in same day surgery coding is excisions. Okay, like how to code if the excision is from the skin level. Okay, how to code if the excisions from the muscle level. So what is the difference and how to identify which level it is? Why means in CPT we are having two sets of codes. One set of code is for integumentary level excision. Another set of code is for musculoskeletal system level excision. So I will teach you keywords how to identify the operative report while learning these excisions. And also mastectomy. What is meant by mastectomy, guys? Anyone knows? What?
Removal of breast.
Yeah, removal of breast. So removal of breast also one of the most important concept in ambulatory surgery coding or same day surgery coding. So you will learn mastectomy also. So how to code radical mastectomy, simple mastectomy. Okay. So how to code implants, what is the difference between tissue expander and implant, how to code replacement of the implant, and how to identify whether it is cosmetic purpose or therapeutic purpose. Okay, why means while learning mastectomy, we need to consider few things. First, you need to check whether it is for cosmetic or therapeutic. Okay, most of the insurance payers will not provide payment for cosmetic purpose. Okay, so those things I will teach you. So in the operative report, how to identify this procedure or mastectomy procedure. Okay, next orthopedic surgery. In orthopedic surgery, these are the common procedures you will encounter. These are the most common: fracture care, arthroscopy, joint replacement. Okay, so fracture care, you will learn how to identify the types of fracture. In fracture care, we are having three types of repairs. Okay, open repair, closed repair, as well as percutaneous pinning. Okay, so I will teach you how to identify the keywords, how to identify open fracture, how to identify closed fracture, how to identify percutaneous pinning. Okay, in arthroscopy, we will learn like how to code shoulder procedure. Knee is little bit easy only, shoulder is most difficult and confusing. So we will learn all these arthroscopy related topics in our live coding, and also joint replacements. Most of the time you will get knee replacements in live surgery. Okay, so we will concentrate mostly on knee. Why means mostly you will not get shoulder replacement, knee replacement you will find. So we will learn all these knee replacement procedures, and also we will learn spinal fusion procedures, which is one of the most complex topic in same day surgery coding. So how to identify the spinal fusion. So what are the key elements you need to check before coding spinal procedures? All these things we will learn during orthopedic surgery discussion. Next one is cardiovascular and thoracic surgery. Okay. In SDS coding, for facility side, dialysis, IVR basics, and catheterizations. Okay. In CPT book, we have Appendix L, which is for interventional radiology coding. So I will teach you that catheterization and how to lead that table. So if you master that Appendix L, you can code any type of IVR chart. Okay. Next, neurosurgery. So we learn what is craniotomy, how to code spinal fusions like laminectomy, hemilaminectomy, foraminectomy, all those things. Next, decompression. When do we code decompression? Okay. Next, plastic and reconstructive surgery. So here you are going to learn what is the difference between flap and what is the difference between flaps and grafts. Okay. And we will learn what is the difference between cosmetic versus reconstructive procedures. These things we will learn during all these sections. Okay, and along with this, most importantly, you need to master digestive system coding. Okay, where you need to master EGD, ERCP, and colonoscopy. So we are going to learn all those things also from digestive system. Okay, next, advanced concepts. So these are the advanced concepts in same day surgery coding. Endoscopic versus open procedure. So we will learn what is the difference between endoscopic procedure versus open procedure. How do we identify? So as soon as you see the operative report, you need to identify whether it is open or endoscopic. So those things I will teach you. How to identify endoscopic versus open procedure. Okay. Next one is bundling and unbundling. So this is very, very important. Using the NCC edits, practically I will show you how to solve this bundling and unbundling edit. Okay. So we will use the encoder software and we will learn these NCC edits. In the live coding also, we will mostly find these things. Next, you will learn inpatient versus outpatient surgery coding differences. What is the difference between inpatient versus outpatient surgery coding? These things we will learn. Why means if you go to interview, sometimes they may ask you, what is the difference between AP versus outpatient surgery coding difference? Next, we will learn common denials in surgery coding. So basically these edits only, most of the time, these edits only the reason for denials. Okay, so we will lightly discuss denial reasons like medical necessity denials, modifier denials, okay, date of service denials, physician denials. Okay, all those things we will learn here. Okay, So next, after completing this one, we will learn all these things again. NCC edits, we will learn common surgical instruments. So if you want to learn same day surgery coding, you need to master common surgical instruments. Why means by seeing the instruments, you need to understand what procedure physician is performing. Okay. Why means sub, each and every instrument is having separate purpose. So we learn all those basics. Next, we will learn types of incisions. So based on incision, you need to decide what type of procedure physician is going to perform. And next, surgical positions. So based on position of the patient, you need to understand what type of surgery and what is the exact location physician is going to perform the procedure. Next, you will learn OP report components. What are the important things you need to abstract from OP reports. Okay. And also you will learn how to find or choose keywords from the OP reports. Okay. And also you will learn go from basics, like you are going to learn how to lead the index. I will teach you that also. Next, we will use 3M software based on the necessity. Okay. And also along with this in-depth training, you are going to learn 40 to 45 charts, live charts. Okay. And along with that, you are going to learn very important Q&A for interviews. And also you are going to learn ICD-10 CM 2026 updates. These are very important for interviews. If you want to go to interview, they will ask you mostly updates. So you need to master these updates also. We will discuss all those things. And after these things, I will provide job support in India, UAE and USA. Few of my students got job in USA also after our training. So I will help you to get job in USA if you are the resident of USA. Okay. Next, along with this one, you are going to get few materials as well as recordings. Okay. So here basically our training is very simple. So in our training, we are going to learn each and every code. Okay. What is the purpose of this code? What is the purpose of this code? What is the purpose of this code? So you are going to learn each and every code along with example scenarios. Not only explanation of the code, I will teach you how to use this code and how to identify keywords in the operative reports. So you are going to learn each and every code. Okay. For example, if you see biopsy, we are going to learn what is tangential biopsy, what is punch biopsy, what is incisional biopsy. So if you go to interview, they will ask you what is the hierarchy of biopsy. Okay. So those important things you are going to learn during our training. Okay. Along with our live training, you will learn interview topics also. Okay. For example, if you go to interview, they will ask you, how do you code if the patient performs 2 incisional biopsies? See here, they have clearly mentioned 11,106 times 1, 11,107 times 1. Like this, using the example scenarios, you are going to learn all this concept. Very important concept. Okay. Next, removal of skin tags. Next, what is the difference between shaving as well as distraction as well as excision? These are very important. If you know the basics, now you can code very easily. Here also, we will learn each and every code. Okay, not only heading 11300, when do we use 300, when do we use 301, when do we use 302. Okay, and we will learn few like calculations also. How to identify the lesion size. Okay, how to code benign lesions. What are the common benign lesions? Okay, and you are going to learn all these topics. How to code the margins, how to code malignant lesions, how to code all other things like adjacent tissue transfers. Those are the very important. So how to code repairs. What are the keywords you need to check while coding in the operative report? Okay. So what is the difference between simple repair, intermediate repair and complex repair? Why means these are very important for interviews also. If you go to interview, they will ask you directly, what is the difference between simple versus intermediate or intermediate versus complex? Those things you are going to learn. Okay. Next you learn what is the difference between ATT versus skin replacement. So if you go to interview, they will ask you when to use ATT, and when to use skin replacement surgery codes. So those important things you are going to learn during our surgery training. Okay. So like this, we will learn from all these sections. So after this one, we will go to musculoskeletal. Okay. Mohs surgery. What is Mohs surgery? So what are the steps to code Mohs surgery in integumentary system? Okay. These are the topics from musculoskeletal system. Here also, you will learn each and every code. How to code spinal procedures. Okay. So what is the difference between these type of approaches? What is lateral extracavitary approach? What is anterior anterolateral approach? How do you identify mostly? What is posterior posterolateral lateral transfer process technique? How when do you code these arthrodesis? Basically, we have two sets of codes for arthrodesis. One is for these procedures, okay, like herniated disc, compression, discompression, all those things. One is for spinal deformity. Here also, fish will perform the arthrodesis. Okay, so we are going to learn difference between the codes. So how to code wrist procedures, how to identify the muscles. So what is a tendon? Okay, so what is bunionectomy? Okay, so those are very important. So if you take other respiratory system, most of the time you will encounter bronchoscopies. So how to code bronchoscopy procedures? Next you will learn sinus endoscopy. Those are also very common procedures you will encounter from respiratory system. So we will learn spinal bronchoscopy and sinus endoscopy procedures. Okay. From cardiovascular system, you will learn these dialysis circuit interventions, IVR basics, and as well as how to check or how to use the appendix L. Why means if you go to interview, they will ask you. So what is the difference between selective and non-selective catheterization? Okay. So if you know that appendix L, you can answer the question very easily. So I will teach that also. So from digestive system, so this is for respiratory AP, what do you call, cardiovascular system. From digestive system, as we have discussed previously, how to code EGD, how to code ERCP, and how to code colonoscopy. Those are the most important concepts or operative reports you will encounter in the same day surgery coding. Okay. After digestive system, we will learn 50,000 series. Okay. From 50,000 series, you will learn male genital system procedure, female genital system procedure. Next, to how to code hysterectomy procedures, how to code myomectomy procedures, how to identify the code based on the approach. Why means in 50,000 series, you will encounter open approaches like hysteroscopy, laparoscopy. How to identify these three types of approaches. In our live training, you are going to learn all those key concepts. Okay. In from nervous system setting, you will learn how to code pain management, injections. Okay. How to code laminectomy. So when do you code laminectomy? What are the keywords to check while coding laminectomy procedures? Okay. And also you are going to learn how to code ear procedures as well as eye procedures. Why means if you go to interview, they will ask you what is the difference between simple cataract versus complex cataract. Those are very important for interviews. Okay. So I will teach you all those things. Okay. For example, if you take here, this is very common procedure. Usually we'll call it as TURP, transurethral resection of prostate. So how to code this procedure? What is the reason for this procedure? Based on medical necessity, we need to code this procedure. And also we'll learn thyroidectomy procedure. Those are the most common procedures you will encounter in the same day surgery coding. Those are the thyroidectomy procedures. As we discussed, along with nervous system pain management and laminectomy procedures are very important. So after this session, you are going to know how to code pain management coding as well as laminectomy procedures. Okay. And also you are going to learn about ear as well as eye procedures. Okay. So like this, here also like same way. So for example, this code is there. So you are going to learn each and every code, not only a section heading. So you will learn what is the difference between 56405, 56420, each and every code, 405, 420, 440, 441, 442. You will learn each and every code. not only subheadings. Okay, so I can stop here. I can provide these specialty trainings also, but based on the number of students. Okay, so already I have posted one video in-depth CPT arthroscopic surgery coding in my YouTube channel. So this is basically a previous session in-depth surgery coding video. If you want, you can check this video. Okay. Next, also thanks for attending this session. So if you have any questions, you can ask me without any hesitation. And if you are looking for any job in USA, UAE, India, you can join in our WhatsApp group. So I will provide this WhatsApp group link in the description of this video. Okay.